going to do is test knee extension. We're going to be focusing on your left knee here. So for grade 0, there would be no contractile activity in the tendons. For grade 1, I would have you go ahead and press your knee into the table, the mat, or the bed. And then I would focus on your quadricep tendons here to see if I see any contractile movement. And then from there, we would go to grade 2. So if I can have you lay down onto your right side facing the wall for me, and then try and scoot back towards me as much as you can, a little bit further back. So for grade 2, I would want to make sure that hips are stacked on top of each other, that he's not leaning back or leaning too far forward. So I'm going to have you lean forward just a little bit here. The bottom leg, I want the knees slightly bent to give it stability. The top leg is the one we're focusing on. So I'm going to go ahead and lift that up. And I'm going to hold your knee, so go ahead and just give me your leg dead weight. We're going to make sure that the hip is extended here and have your knee flexed to 90. And what I want you to do is go ahead and straighten out your leg for me. There you go. So grade 2 would be, go ahead and relax. A grade 2 would be available range of motion with no resistance applied to that. And then moving into grade 3, 4, and 5, I'm going to go ahead and have you seated for me. Okay? So you can go ahead and lay back onto your back for me. Okay, so now what we're going to do is test for grades 3, 4, and 5 for a knee extension, still focusing on the left knee here. I'm going to place a towel roll underneath the distal part of your thigh for comfort, so if you can lift up for me, please. Place that right there. Go ahead and relax. So for grade 3, I'm just going to be testing range of motion. So before you do the movement, what I want you to do is you're going to straighten out this leg, but try not to lock out your knee. So have just a slight bend. So go ahead and try that for me. And then back down. So what I'm looking at when he's doing the range of motion is that he's not leaning forward, he's not leaning too far back. You are able to bring your hands down to the side, grasping the chair, table, wherever he's sitting. That's perfectly fine. But just trying to make sure that he's not leaning over to the side or lifting up his leg, anything like that. I'm just watching for all of those movements. So what I want you to do again is to straighten out your leg, but I want you to try and hold it for a count of 5. I'll go ahead and count for you. So go ahead and straighten, hold, 3, 4, and 5, and relax. So if I see he has good range of motion, I'll move on to grade 4. So grade 4, what I'm going to do is apply strong resistance to the top of his leg here while having my hand here on top of his thigh for stability. So again, I want you to go ahead and go into that motion, and I'm going to just apply some resistance, and I don't want you to let me push your leg down, okay? So when he goes into extension, I want to make sure his knee is not locked, so slightly bend your knee. Okay, that's good right there. I'm going to place my hand up here, don't let me push you down. Hold that, 3, 4, 5, good, and relax. So that would be a grade 4. A grade 5, I would apply maximum resistance. So go ahead and straighten out your leg for me. Again, try not to lock out your knee. Have a slight bend there. Okay. So don't let me push you down. 3, 4, 5, and relax. And I can feel those quadriceps working right there. And while I'm doing that, I'm also just, again, looking for to see if he's doing any substitution movements or anything like that as well. Okay, so for the next test, we're going to be testing your knee flexion. So for grades 0 and 1, I'm going to be focusing on his right knee here. So I have him laying down prone. I'm going to go ahead and lift up his bottom part of his leg to where his knee is slightly flexed. And I'm going to support his ankle here. And then I'm going to be looking for contractile movement at the tendons here of the hamstrings. So for grade 0, it would be no contractile activity, no movement at all. For grade 1, I would see that he would be trying to flex his knee. So that means that his tendons would have contractile movement that I would be able to see there. And then for grade 2, what I would do is have him lay onto his side And for this purpose, I'm going to have him actually lay facing the wall. So he's going to lay on his right side, and then we're going to focus on his left leg. So if you can lay on your side for me, please. Okay, so we're going to be focusing on his left knee for knee flexion for a grade 2. So what I'm going to do is I'm going to lift up this leg. Again, I'm going to support underneath his ankle, and I'm going to have my other hand underneath his knee for support as well. So what we're going to start off with is his knee is going to be partially flexed. His knee is going to be extended, it's going to be straight, and then without applying any resistance or help from me, what I want you to do is go ahead and bend your knee as far as you can. Alright, and then back. So for a grade 2, it would be to where he completes that range of motion. Go ahead and relax, thank you. In his available range of motion, and that would be a grade 2 because gravity is minimized. Okay, so now testing for grades 3, 4, and 5 of knee flexion, focusing again on the right knee. I have a rolled up towel underneath his leg just above his knee for comfort. What I'm focusing on is making sure that his hips are aligned, that he's not lifting up his leg off the table or mat or bed, and then of course asking to make sure that he's not experiencing any pain anywhere in his back or of course his hamstrings. So for a grade 3, I'm just going to be looking at his range of motion when he bends his knee. So just focusing on the right leg. If you can go ahead and bend your knee for me, please. Alright, and then back down. Also making sure that his toes are hanging off the side of the bed as well. Alright, good. So now what I want you to do is that same motion, bending the right knee, but now I want you to hold it for a count of 5. I'll count for you. So go ahead, hold, 3, 4, 5, and relax. So for grades 4 and 5, I'm going to be applying moderate to strong resistance and the maximum resistance. For grade 4, I'm going to be stabilizing here where his hamstrings are. Other hand is going to be on the back of his leg by his ankle, or just above his ankle, and that's where I'm going to be applying the resistance. So go ahead and bend your knee for me. Hold it at about a 45-degree angle. I'm going to place my hand here. I'm going to apply resistance. Don't let me push you down, okay? Go ahead, hold, 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 and relax. Alright, so that would be a grade 4. And then a grade 5 would be applying maximum resistance. So again, go ahead and bend your knee for me. Stabilizing here, hand here. Don't let me push you down. Hold, 2, 3, 4, and relax. Okay, so the next test is going to be foot dorsiflexion and inversion, focusing on your left foot. So for grade 0 and grade 1, I would have the patient supine. For grade 0, there would be no contractile activity, looking for palpation of the tendons at the tibialis anterior muscle, which would be located here. And then for grades 1, it would be to, if I ask the patient to try and perform the movement, which would be bringing the toes back towards them and then bringing the foot inwards towards their other foot, I would check here to see if I could see any contractile movement in that tendon for grade 0 and 1. And then for grade 2, I would also go ahead and have them supine and see if they can just complete a partial range of motion of this movement again. So if they were able to do just a little bit of dorsiflexion, so go ahead and try to bring your toes towards you and then bringing your foot inward. Any type of movement, even if it's a partial range, just not to their full range of motion or available range of motion, that would be a grade 2. So go ahead and relax. And then for grades 3, 4, and 5, I would go ahead and have the patient seated. Okay, so now continuing with foot dorsiflexion and inversion, again focusing on the left foot here. For grade 3, it would be if the patient could complete available range of motion. So I would have the patient ask them to bring their toes towards them. So go ahead and do that for me. And then bring your foot inwards towards your other foot. Alright, and relax. Perfect. So again, they're able to have their hands on the side of the chair, the table mat, just for stability. and I would just be making sure that they're not experiencing any pain. They're able to go in their full available range of motion. So go ahead and do that again for me. And I want you to hold that for a count of 5. I'll count for you. Hold, 3, 4, and 5, and relax. Okay, so for grade 4 and 5, that's when I would apply the resistance towards that. So I would be pressing, since they're going up and in, I would be pressing out and down. So basically just don't let me push you down. So go ahead and bring your toes towards you and inwards. So what I want you to do is don't let me push you down. Hold, 2, 3, 4, and relax. So a grade 4 would be moderate resistance, and then a grade 5 would be maximum resistance. So go ahead and bring your toes towards you and in. Okay, don't let me push you down. Hold, 2, 3, 4, and relax.